Hey guys, so today I wanted to talk about something which I felt is very important for people, let's say, who might have visited a doctor and may face a condition where they might have been diagnosed for a heart condition or for stroke or for type 2 diabetes. Your doctor might have said that you're at that borderline, as of now you're safe, there's nothing to worry about. But what I would suggest you is, if in case you have made those trips, please do make sure that whether you don't have a topic which is called as metabolic syndrome. Now, what is metabolic syndrome? Metabolic syndrome is basically a set of 5 biomarkers which, if in case you cross that specific level, and this should happen in all, then you have metabolic syndrome. And what can metabolic syndrome do? It can lead to multiple diseases at once. You could have heart conditions, you could have stroke, you could have type 2 diabetes. So, why am I talking about this metabolic syndrome? So, I'll just take an example of triglycerides, which is part of a lipid profile. Now, triglycerides, the normal range is between 25 to 200. Whereas, if you are having metabolic syndrome, chances are that your triglycerides must be above 150. Now, if you visit a doctor and you show him your lipid profile and he sees that your triglycerides is, let's say, 170, he wouldn't see it as a problem because he's just seeing from that one dimensional perspective. That is, he's only seeing the triglyceride markers, but he might not know your other markers and what they could lead to. So this is something for your awareness, that you should be knowing that you too could be near that level of metabolic syndrome, which could lead to those other diseases. So what are these 5 markers? So the first marker is blood pressure. If your blood pressure is above 130 or 80, that is the first marker. You have to be careful of that. Second marker is again the topic we just talked about, triglycerides. If it is above 150 milligrams, you are at risk. So just don't be comfortable that okay, I am in the normal range. If you are above this figure, you have to check the other markers too. Now, second was triglycerides. Third is HDL. If your HDL is under 40, you again are at risk. So here are 3 markers. 2 are connected to your lipid profile. Now the fourth one is your fasting glucose. If it is above 100 grams, you're at risk, and again there are suspect for metabolic syndrome. And finally, your waist circumference. For the general US population, if your waist for men is above 40, you're at risk. So now you can compare that with the South Asian population, which should be around 36 inches. So again, for South Asians, if you're above 36 inches, you are at risk. Now, if you combine all these 5 markers and if you cross all those levels, you could have metabolic syndrome. And again, just be wary that you could be leading to those heart stroke or heart disease or type 2 diabetes. So yeah guys, that is something which I wanted to bring attention to you guys and to help you know to assess how to assess your health. Okay guys, thank you.